I'm sure you've heard this myth more than 100 times. My grandparents cooked with lard, ate pork rinds every day, and lived to be 100 without ever having a heart attack. And you should know that because of this myth, in recent years on social media, it's become trendy to throw away heart-healthy oils, which I'll mention at the end of the video, and start cooking everything with lard, using the excuse that it's more natural, or today we're going to put them head-to-head, face-to-face, to battle extra virgin olive oil versus classic lard. We'll look at their chemical makeup, what they do to the lining of your arteries, and what the latest studies say to be sure of the best option for your heart. And let's see. Pork fat or lard is extracted, as the name suggests, from, so to speak, the adipose or fatty tissue of the animal. It is a fat of animal origin. This is then extracted at high temperatures and then cooled down to be used for cooking. Look at what it's made of. 50% of the pork fat you consume contains oleic acid, which is a monounsaturated fat, and we know that monounsaturated fats are good for the heart. They don't increase LDL, and sometimes they can raise HDL, the good cholesterol. 43 to 45% of it is saturated fat, mainly palmitic acid and stearic acid. And we know that palmitic acid is one of the ones that raises LDL cholesterol the most. It's like giving the liver the whole sauce, giving it the material to build more LDL molecules, so more of them circulate in the blood. And 5 to 7% is linoleic acid, which can sometimes turn into a high-quality omega, but other times it can turn into omega-6 at high temperatures, which we know is pro-inflammatory. Because it has a high amount of saturated fats, this makes it highly palatable, which is why some say, lard tastes better. That's true. I won't deny it. But let's move on to talk about extra virgin olive oil. The extraction method, unlike vegetable or processed oils, is that the olive is simply crushed to release its oil. This must be done cold for it to achieve its extra virgin status. And we know it has a slightly more acidic flavor. But you'll see that in its composition, 75 to 80% of this oil is monounsaturated fat, oleic acid, right? It has much more than lard does. 10 to 12% of it is saturated fat, which is there to maintain its stability. But here's the interesting part. That acidic taste is because 2% of it is antioxidants, polyphenols like oleocanthal and vitamin E. And we know that what antioxidants do in the arteries within the blood is grab those LDLs or inflammatory fats, remove their oxidation, and prevent them from entering the arteries further. But doctor, what about my grandparents who lived for many years consuming that lard? Well, you'll find the explanation interesting. There's an association fallacy here, thinking that because they ate pork, they lived longer. But I'm going to explain some interesting things there. Our grandparents weren't exposed to so many processed foods and food industrialization. 2, they moved much more and consumed fewer calories. You realize that? And most were thinner than people are today. 3rd, the pigs back then from which the fat was extracted were more outdoors, raised better, and had more vitamins. Nowadays, pigs are exposed to many chemicals and processing. And if we add to that, when we wanted to prevent heart attacks and started, so to speak, saying all saturated fats were dangerous and the idea was to lower consumption, not eliminate them, many went to the other extreme, consuming ultra-processed foods with lots of high fructose corn syrup. It raises your sugar, causes inflammation, and contains trans fats, which are more dangerous than saturated fats. So the problem is, we went from one extreme to the other, when we really should have stayed in the middle, looking for better quality fats, eating vegetables, complex carbohydrates, whole fruits, and legumes. That's the problem. And that's why many influencers and people who want to sell you keto and paleo diets currently use this manipulated argument to tell you that lard is the best option today. But if you still don't want to believe me, and I'm a cardiologist, I read studies every day, I see patients with artery problems, cholesterol, heart attacks, I say fine. It's not just about belief, it's about seeing what science says today and what it has found to be the best oil you should use. And over 15 years ago, a study was conducted, a very large one with 8,000 people, one of the most important in cardiology, called PREDIMED, where they saw that the Mediterranean diet, and what do you think they use in the Mediterranean diet as oil? Extra virgin olive oil. It was shown to reduce cardiovascular events like heart attacks, strokes, or peripheral arterial disease by 30%. What does this mean? It's because every time you choose extra virgin olive oil, and this is already mentioned in the most current 2026 guidelines for cholesterol and lipids, 2025 for cardiovascular prevention, American, European. The thing is, after testing all the oils for daily use, olive oil still wins because it helps raise HDL, lower LDL cholesterol, helps control triglycerides, and improves the inflammatory state of the endothelium, which is that innermost layer that gets damaged every day and where fatty plaques build up, while also being safe. But I'm sure many of you will say, "Doctor, but when it comes to cooking and the smoke point, you really have to be careful." Let me explain, and this is the bit that's going to blow your mind. The smoke point is the moment when a fat, when exposed to heat and reaching a certain temperature, can oxidize and become harmful, releasing compounds that can be carcinogenic. And look how interesting, lard, because of its saturated fats, is much more resistant, up to almost 190 degrees Celsius, unlike vegetable oils. So in that sense, it handles that heat much better. But look at this. Extra virgin olive oil has a smoke point at 210 degrees Celsius, which is much higher. But how, doctor, if it has less saturated fat? That's where it has that bulletproof vest that sacrifices itself, which are the antioxidants and polyphenols, and they resist oxidation. And here's an expert tip for you. If you see that your olive oil starts to smoke a lot, then consider that it's losing its natural components. And that's why I ask you, why use a lot of oil? Why fry unnecessarily? Do it for very specific things, preferably steamed, preferably with heat like an air fryer. And remember, every time you add oil to meat or any food, you're adding more calories if you're trying to lose weight. That's why a bottle of olive oil lasts me almost 4, 5, or 6 months. And yes, it might be a bit more expensive, but it's the best option for your heart. And that's where I ask you, what oil are you going to keep using? Or what are you using right now? Let me know in the comments section. Test yourself, check your lab results, and you'll see the amazing things that are going to happen. I want to hear from you. Follow me on my other social media. If you have tests or lab results and want me to review your case and guide you, I have pinned my website in the first comment. And I recommend watching this very interesting video about blood pressure. Also, if you have anxiety or panic attacks and you've had tests but don't understand what's happening with your heart and want to improve, I also have Calm Heart. And hoping that all this has helped you, don't forget that this is exactly what your heart needs.